I'm supposed to be being cared for, and actually I'm just being traumatised.
Alexis had only just become a mum when her younger brother Josh suddenly died. Struggling to cope, she asked her GP for help, but her autism was misdiagnosed, and a psychiatric referral led to 3 years of being locked away from her daughter. While in care, Alexis says she was the victim of repeated sexual assaults.
I was the only female in a ward of 18 men. You'd think that you'd fight. You know, I'm a 6'1" woman. I had this sense that, oh, if that had happened, I would have fought. But you are so terrified.
You're paralysed with fear.
Completely powerless.
Freedom of information requests made by Sky News and The Independent have discovered since 2019 there were nearly 20,000 new sexual assaults and harassment complaints involving patients and staff across more than 30 NHS trusts. There have been more than 800 sexual assaults or rape allegations involving women across more than 20 trusts, with only 95 cases believed to have been reported to the police. And over 500 allegations of sexual assaults or rape on mixed-sex wards or mixed spaces across more than 20 trusts.
Have you been shocked or surprised even by the scale of the abuse?
In the 12 hospitals that I was in probably 10 of those, there always felt like there was the potential for that threat to happen. And I experienced a lot of, physical violence, a lot of sexual violence.
We asked all NHS mental health trusts in England to provide evidence that they are applying government-backed sexual safeguarding protections. Only 6 provided this information.
60 to 80% of people who end up as an inpatient in a psychiatric hospital have either experienced sexual abuse or sexual violence already. When that kind of incident is occurring on a psychiatric ward, where you should feel safe, you are re-traumatising people.
Kenton Medway NHS Trust has apologised to Alexis for the unacceptable behaviour she experienced in their care. They tell Sky News, over the last 10 years, we have made improvements to the quality of care we deliver, including eradicating mixed-sex wards and significantly reducing our use of restrictive practices. NHS England says it has advised all trusts and local health systems to appoint a domestic abuse and sexual violence lead to support patients and staff to report incidents. But Alexis says change needs to happen quicker.
Nothing's changed, and nothing's going to change unless significant action's taken.
Ashish, Joshi, Sky News in Kent.
Well, in response to our report, a government spokesperson said sexual violence or misconduct of any kind is unacceptable and has no place in the NHS, and NHS organisations have a responsibility to protect both staff and patients. We are working closely with the NHS to ensure anyone receiving treatment in a mental health facility receives safe, high-quality care and is looked after with dignity and respect. And if you scan the QR code on your screen right now, you can listen to more from Patient 11, Sky News and The Independent's new investigative podcast telling the story of one young mother's escape from a hospital and the issue of sexual assault in NHS mental health care. All episodes are available now wherever you get your podcasts.